Hello, everyone. I think it's time to start the session. This is the GERA webinar series. My name is Siham El-Mrayed, and I'm faculty at the School of Science and Engineering here at the American University in Cairo. And it's a true pleasure to get to introduce our guest speaker today, Dr. Padmini, who is a globally recognized health professional and educator in her roles as a physician and public health expert. She is professor and global health director at New York Medical College School of Health Sciences and Practice in the United States. She's also the chair of the International Health section of the American Public Health Association and global health lead for the American Medical Women's Association. She's an NGO rep to the United Nations and a very well-respected NGO leader. Dr. Murthy has made over 170 presentations nationally and internationally and is widely published. She is the author and editor of Women's Global Health and Human Rights, Technology and Global Public Health. And her other books include Minnie's Musings and Glorious Global Ganesh. Dr. Murthy has been the recipient of numerous national and international awards, including first Indian-born American in 75 years to receive the Elizabeth Blackwell Medal, recognizing her work in promoting women's health globally. She has also been the recipient of citation from New York State Assembly for her contributions as an outstanding leader in medicine. In December last year, Dr. Murthy has been the recipient of the President of the United States Lifetime Achievement Award for Volunteer Service. And in March of this year, Dr. Murthy was named member of the official United States delegation to the 66th United Nations Commission on the Status of Women. Please join me in welcoming Dr. Murthy, who will speak to us today about women's health in the era of climate change. Thank you very much for your time and for joining us, Dr. Murthy, and I'll pass it on to you.
Thank you so much for having me, all the organizers, Dr. El-Mrayed, Dr. Avni. It's really a pleasure. And I think one of the things about webinars is we connect with less of carbon footprints. So I think it comes in nicely with what I'm going to be speaking about. I'm just going to share my screen now. So is my screen seen? So that we'll get straight moving. Okay.
Yes. Yeah. Thank you.
So thank you. First of all, why should we even be concerned about climate? What is climate crisis? It's ongoing due to so many different activities contributed by humans to this very crazy weather patterns. And I know we are dealing with COVID, we've dealt with other pandemics, we are dealing with something else, chronic diseases, but the biggest crisis we are dealing with, which is a global issue, is climate change and how it affects women's health. So as you can see briefly, my objectives are to discuss the linkages between the climate crisis and SDG 3, which is good health and well-being, and also what are some of the challenges faced by women globally due to this ongoing climate crisis. And I will be very briefly discussing examples of best practices in addressing the effects of these climate changes, and also list purposeful partnerships and their role in promoting climate crisis. So first of all, before I get started, I think I need to really give a big shout out to our hosts here, because it's nice that Egypt is hosting the 27th COP. So it's really nice. So I just want to say this. When I was doing my research, and one of the reasons I'm so interested in climate crisis and changes, because it affects us in many ways. And there is also an intergenerational effect of climate change, which I will be discussing later. So as you can see, this picture is a mother with her child. And unfortunately, this is so true in this World Health infographic, so well stated that from big cities to small islands, Climate change is hurting our health. So climate crisis is real, and the effects are tremendous, because not only is it an economic crisis, an environmental crisis, a social crisis, it's also a health crisis. And I may be biased in saying this, but I think being a healthcare professional, if you don't have health, you don't have anything else. So SDG 3 is really crucial. And that's why we need to do everything we can to make sure communities are healthy. And we need to start by working at the grassroots level. And at the grassroots level is to make sure we are responsible consumers and protect our planet. So that being said, moving on, these are the SDG targets. And as you can see, target 1 talks about reducing maternal mortality. Now, with the climate crisis going on, the first thing which comes to our mind is women are at the receiving end of the aftermath of the horrific changes of climate change, because it affects them due to lack of access. There are climate refugees who have to move from one place to the other. And if the woman is pregnant or she has a small child, it gets even harder because the systems are disrupted. There is lack of access. And again, just moving on briefly to target 2, when we are talking about ending all preventable, deaths and everything, especially for infants up to 5 years, there is increased infant and child mortality because of the climate crisis. You see, there are so many people displaced due to climate. And please note, for 1 minute, we are not focusing on, when I'm talking in this particular slide, about armed conflict, but we are talking about the disasters which occur due to climate. What happens? Children are affected because often they are the disenfranchised population, like people with special needs, and it's harder for them to face these challenges. So all these targets which I have put here, which are the SDG targets, are definitely impacted by continuing climate crisis. And it gets harder for the world to reach the 2030 agenda, the centerpiece of which is leave no one behind. How can you not leave or be inclusive when you have so much of climate catastrophe going around the world? And now I'm just going to stop sharing my screen, and I'm going to request Dr. Saham to kindly share her screen. So can you go ahead and share your screen, please? Then my screen share stops to show us the video. Thank you.
Yes, we'll do that right now.
Thank you so much.
You're welcome. Okay. Can you see it okay? Can you see the screen, Dr. Padmini?
No,
I've stopped my screen share. Can you show yours?
I should be sharing it now. It's showing me. I'll try again. Okay, sharing. Can you see the YouTube window? Or not yet?
Yes, we can see it now.
Okay, perfect. I'll start the video then.
When you share it, can you just take it off and share it again? When you share it, could you allow the voice of from the PC itself? There is an option.
I'm sorry, that's technology, but I'm sure we will get back to that. Could you please try sharing your screen again? Thank you. Sorry about that. Dr. Awad, would you like me to try to share it?
Sorry, Dr. Padmini, I'm just confirming. Can you see my screen?
Yeah, we can see your screen, but we can't hear your the sound, the audio.
Oh, okay. Because, yeah, I'm just sharing directly from YouTube. Okay, I'll try again and please.
I think as Dr. Awad said, or can the technical team just share this screen for us? Maybe they can do it.
Yeah, I'm happy to share the link to the video with the team. I'll just do that and stop
Maybe
sharing.
you could send it to Dr. Awad.
Yeah, we'll do that.
Thank you for your patience. That's the thing about technology. So sorry. It will be shared briefly. And let me tell you, it's worth the wait because this is like really interesting and it gives the segue for our continuing discussion. So thank you for your patience and it should be shared shortly.
Yeah, it should work now. Thank you. There is unfortunately no sound, correct?
I don't know why there's no sound because the whole thing, I cannot hear the sound. I don't think anybody can.
Yeah, no, me neither. No sound. That's interesting because we usually share from YouTube and it works fine.
Okay, so what I'm going to do is.
At least we got an asteroid.
Oh,
What's
we
yours?
have it now.
You're headed for a climate disaster. And yet every year governments spend hundreds of billions of public funds.
Can we show the
on
movie,
subsidies.
please? The clip with the sound?
Imagine if they'd spent hundreds of
Hold on a second.
billion.
Can you hear it now?
No.
No, I think, let me try for 1 minute if I can show this from my thing to just see. So If you stop sharing, I'll just share my screen to see if it works. I can't show it. No. Okay, so maybe we can go back to it later in the interest of time. May I request you, Dr. Abbas, to send it to your technical team if they can see why it can't be shared, the sound, because it's really worth doing it. So I will continue. So sorry, everybody, but definitely we will show you this video. So continuing, unfortunately, as you can see in this picture, gender inequality is always coupled with climate crisis. And this has been one of the greatest challenges, especially for women in their livelihoods. You can see this picture, which is photo credit goes to UN Women, as to why, women are having, yes, you can see they're washing clothes, they are drying them, but due to climate crisis, whether there is flooding or there is famine, if there is not enough rainfall due to famine, they have to walk long distances to get water. And as we all know, so many girls do not go to school due to lack of water. And why is that? Due to these erratic climate patterns. And I was in Utah just 10 days ago for the first academic United Nations Sustainable Development Conference. And I was talking to some of the people from Utah who said that the rainfall in Utah has reduced. And even due to climate changes, they usually get water from the melted snow, but they are not getting as much. So they have to conserve water. You see how this is a boomerang effect of what is going on. So these are some of the challenges being faced. So now just think, we are in a place where we have to get water. Especially it falls onto the burden of the girls and women. I'm not saying it because I'm a woman or I have a daughter, but unfortunately, due to the traditional gender norms, it is the woman who provides with the basic necessities, such as food supply or getting water. So what happens when she cannot get water? This is a major issue, because she has to travel long distances, and the amount she has to travel may even increase because of the ongoing climate change. And as you can see in this slide, and how climate change is affecting the health, unfortunately, there's an increase of Lyme disease. There has been an increase in malaria. And let me tell you something, with all these changes going around, with every 1 to 2 degrees rise in temperature, what happens? It's just not somebody feeling hot. It's the increases in cases of malaria. And why does this have an effect on women? Because usually women are at the bottom of the ladder when it comes to getting protective equipment when they are working against malaria, or when organizations like Nothing for Nets supply them with nets. They do not have access to sleeping under the nets, because usually the males in the family take the nets. So, and they do not have enough mosquito repellent to add. They do not have access to anti-malarial medications. And many times in some countries, as we know, there are a lot of spurious malarial medications, medications for treatment, which they take because it's cheaper. They lose, work. And a pregnant woman, if she gets malaria, increased risk of preterm birth or having an abortion, because the malaria parasites can be so toxic. So again, this is one of the ways the climate change also affects the health and well-being. And I just gave you the example of malaria, but there's so many diseases. And as you can see, even, West Nile virus has increased due to this. Now, what happens due to climate change. So women and climate change, this infographic talks about what happens in the Ganges River Basin in Asia. And so what happens when the temperature increases, when it gets so hot, women are not able to go out and do their chores, like, whether they are farming or agriculture, growing crops, harvesting crops. They do not have protection. Please note, often, even though there are protective clothing available, it is not gender specific in many countries. So you either have clothes which do not fit you well, or they are so big for you that you cannot see where you're walking. So the protection is not optimal because there is no gender specific protective gear made for women. And then what happens next? Especially, as I said, the Ganges River Basin is in Asia, and it's in, as you can see on the slide, parts of India, Nepal, and Bangladesh. What happens? Women cannot even earn the little they earn by either bringing home the crops or selling the crops. There is an increased incidence of domestic violence. Yes, ladies and gentlemen, domestic violence against women, or gender-based violence, as we call it, is linked to climate change because of they're not being able to be productive at the optimum. Often they are blamed, they are beaten, they are harassed, and when there are less food, it is food insecurity. And who is the one bearing the brunt? It is women and the girl child. So this is a major challenge. And again, they do not have access to the regular things because the supply chain is often disrupted because of environmental crisis, either due to flooding when you don't have crops, or due to famine when you have crops. So moving on, as you can see, this is such a classic picture. In low and middle income countries, women carry the water. Now, do you know, often they don't even have anything protective on their heads to carry the water. They just fold a piece of cloth, put it on their head to carry the water. They have to walk a lot to bring this water. And often they do not have access to the water they have brought because it has to meet the needs of the family. And unfortunately, this is a sad story. It's reality. It's not fiction. And as you can see, I'm just going to talk about India briefly here. In India alone, women make up over 65% of the agricultural workforce, and a lot of them are informal laborers. They are just paid not in cash, but sometimes they are given the produce they help to grow. And when there is a famine or flooding, the amount of produce they get as their share gets reduced. So what happens? A pregnant woman or a growing child, a girl child especially, will have lesser access to that. And I just want to share one example, not to digress, but just to say that, when there was the Bangladesh war, when the Bangladeshi refugees came, and they were in camps. They came to India. They were in camps near Calcutta, in West Bengal. And the problem was when they were given food rations, just to tell you, that the mothers and the fathers gave more food to the boys than the girls. The reason I bring this up is because of the societal roles. This perpetuating gender inequality is continuing. And just to highlight one other thing, there is a difference between equity and equality. Many people interchange these words, thinking they're the same, but they're not. Equality is to make sure everybody has the same access. Equity is to make sure that the person with less access is given extra by having the same access, so that you make the playing field equal for all. That is equity, ladies and gentlemen. So coming to this, what happens, because when a woman is pregnant, if she's exposed to these horrific effects of climate change, as I said, they can be preterm birth, they can be low birth weight, they can be stillbirths due to the toxins, lack of food, and effect on brain development. If you remember early on during my introduction, I was very clear in which I said climate crisis effects are intergenerational. Well, if the mother is affected, the baby is affected, you can have low birth weight, stillbirth weight, or effects on the cognitive or the brain development of children. So what can we do? We need to make sure that we all work together collectively to address climate change. And I just have a few bullets here, but one of the things I want to make very clear is that indoor pollution, women, when we are talking about climate crisis, it's just not external, it's also indoors. When we're talking about climate crisis, so many times women and children are exposed to the pollution in the houses where still fossil fuels are used to cook food, and there is not enough ventilation. So studies and research has shown that women and girls have a higher risk of environmental challenges, respiratory diseases, chronic diseases such as asthma, COPD, restrictive diseases, which can occur due to air pollution, both outdoors and indoors. And this is a take-home message for all of us, that when we are talking about environment, we also need to be equally concerned about making sure the environment in a workplace, in a school, in homes are as optimal as possible. You can see in this chart the impact of climate change on human health. And this is something in increased risk of injuries and fatalities. And again, I just want to focus, and then again, my slides will be posted by the organizers. So you can see the forced migration and civil conflict is a major issue, because there are what are called water wars. And women, unfortunately, even are fighting. It is a common occurrence in some parts of Southeast Asia. I have seen them. Women are standing to get water because there is no enough water. And then it results in fighting, because if the water supply runs out. How can all this be prevented? We don't have a magic wand, but it's responsible action and it's collective efforts to see what we can do. Moving on, armed conflict is a major issue. And one of the things I want to talk about is, this is scary, folks. In sub-Saharan Africa, a decrease in rainfall from the previous year of 5% increases the likelihood of civil wars by the following percent, by 50%. I just used the term water wars in my previous slide. This absolutely reiterates what I said. So again, you see the challenges. And what are the results of climate change, climate crises on women? You have, as I said, it is very, very clear. And this chart, the reason I have this up, because it explains it so scientifically, because biologically, women have increased metabolic rates and the cooling mechanisms are lower. And when there's extreme temperature variations, it causes increased health risks. The same thing when there's extreme winter, very cold weather, women are at higher risk. Again, gender discrimination, lack of access, poor communication. Women are not health literate when it comes to how they can protect themselves against the climate crisis. Poor air quality, I talked about this earlier, rainfall patterns. Anemia is a major, major issue, which is affecting women all over the world. And this can be attributed to climate crisis because enough of nutrients, especially iron and micronutrients, are not there. Again, women are at more of an increased risk for food insecurity. Please note food insecurity than men, because they do not have protective inbuilt mechanisms to address this issue. Moving on, climate change affects us all. And it is really, we need to have a human rights approach. Why? We need to understand that every action, whether it's an individual action, collective action, policy action, or a law in place, we need to factor in how does it affect everybody, including women and the girl child or people who have special needs. So you need to look at everything in a human rights lens with a human rights approach. Is it fair to all? Is it equitable? I just talked about the term equity and describe the difference from equality. So that is something we all should be concerned about. And unfortunately, we have so many climate refugees. We have climate refugees where we live, in the same areas where we live. I mean, in our cities, in our countries, and we have climate refugees who go from one country to another to escape the aftermath of climate change. So climate refugees are increasing. And also, it is terrible because you have what are called internally displaced people as a result of climate, and then you have refugees. Refugees is the term used when they cross from one country's border to another. And this is not because of armed conflict so much, but because of climate. So these are some of the women climate refugees. You can see how they are wading through water here, and then how they are walking miles and miles to escape the harsh climate, because they do not have the mechanisms or access or the built-in infrastructure to protect themselves. So they try to take their families, especially their children, and move on. And the other thing is, I just talked about malaria, which I told you is a major issue. I told you how, again, gender. This woman is lucky. She has a mat. She is sleeping with her children. A lot of times it will be the man of the house sleeping next to the children. So this is something we all need to be aware of. And as you can see, this is like really nice. So these women are making sustainable products from cocoa, and they are doing rice farming. These people have received microcredit loans from NGOs and the UN Women, working with other partners. So by making sustainable products from cocoa, she's able to sell these products. They're natural, and she's getting an income, and also rice farming, using new methods of rice farming. And then moving on, the other thing is we have what are called pollinator gardens. We are doing this in our own university, and it's being done in many parts in the US and maybe in other countries too, where you have this natural plant repellents against mosquitoes. And also by having pollinator areas, we are growing natural plants in their own habitat, so that there are more benefits for the population. And remember, the more plants we have, the more oxygen we have, the more green it is better physically and mentally, because it helps our psychosocial well-being. Moving on. So the CSW, which Dr. Seham very kindly introduced me, that I was one of the official delegates representing the United States to the Commission on Status of Women, where we talked about this year about the climate change and environment disaster risk reduction, to say that gender equality, and I would add equity, needs to be the center of solutions. You need to have women at the table when you are talking about policies which address women, especially with climate change, and make sure they have access to protective clothing when they are working outside, which fits them. So this is something we all need to be focusing on. And then, so partnerships are really, really important. And as you can see, The General Assembly of the United Nations works very closely with with all these agencies here. And you can see that's how you have the COP, which now we have the upcoming COP in Egypt, which is really very nice. And then you have the IPEC, you have the UNFCCC, you have UNEP. And one of the other issues is UNHCR also is an important player in this, because they are the ones who really are responsible for refugees, and the needs of the climate refugees are slightly different from the refugees of armed conflict. So moving on, almost finishing up. So what are some of the recommendations? Again, I have a YouTube, but I do not want to put this YouTube on. We'll try to get the other one. What we need to do is we need to have multi-stakeholder partnerships. Women need to be at the center of policy making and initiatives. Youth engagement. I mean, we have all these people, so many youth climate activists here, but they are really at crucial, and it's like really amazing. And we need to have prioritization of climate change, excuse me, in every policy we come up with. And it is an individual and collective responsibility. And also having webinars and academic discussions like this really helps to come together, because we talk to somebody, oh, we have a similar problem, and this is what we did. And then we say, okay, maybe this helps. So this is, excuse me, global partnerships are crucial. So this is really important, folks. We need to understand there is no planet B. This is the planet we have. So we need to make sure whatever we do, and we have to be a part of the solution and not of the pollution. I really like this, which came in The Guardian a few months ago. There is no planet B, and people like Greta Thunberg. I mean, I saw that kid. She's like amazing. She's like this small. And like, you know, she just really went out and she just told the world leaders, how dare you, because you are not thinking about us. You're not thinking about the planet. And we really need to make sure that we are doing what we are doing. And the reason I just have this slide again to show that unfortunately how much the rainfall does lead to all these issues of civil war, armed conflict, violence, and it is so sad. And these are my references. And I hope we can get this slide up, because I would really like you to see the video. So thank you. I'm just going to stop my screen sharing now. Thank you so much. And can we try to see if we can get the video up, please? Thank you. Thank you.
Thank you so much, Dr. Murthy, for an inspiring and extremely interesting presentation. I think the technical team is working on getting the video to work. So we'll just allow them a minute or two to see if we can get it to work before we open the floor to questions. But thank you again very much.
Let's hope we can get this, because this is really a good video, and it's like very short too.
It is. I actually watched it just before the session today. I thought it was very well done.
So I don't know what the issue is.
Yeah, because I usually share from YouTube and it works just fine.
Maybe we could start the Q&A, and by the time they figure it out, because I really hope it shows, because that was one of the highlights. I'm feeling so bad that it did not come through.
No, I know what you mean. Let's keep our fingers crossed. And yes, thank you again. I'll open the floor to questions now. Oh, there it is. There it is.
You okay? You need a minute? Cool. Okay. Listen up, people. I know a thing or two about extinction. And let me tell you, and you'd kind of think this would be obvious, going extinct is a bad thing. And driving yourselves extinct? In 70 million years, that's the most ridiculous thing I've ever heard. At least we had an asteroid. What's your excuse? You're headed for a climate disaster, and yet every year governments spend hundreds of billions of public funds on fossil fuel subsidies. Imagine if we had spent hundreds of billions per year subsidizing giant meteors. That's what you're doing right now. Think of all the other things you could do with that money. Around the world, people are living in poverty. Don't you think helping them would make more sense than, I don't know, paying for the demise of your entire species? Let me be real for a second. You've got a huge opportunity right now. As you rebuild your economies and bounce back from this pandemic, this is humanity's big chance. So here's my wild idea. Don't choose extinction. Save your species before it's too late. It's time for you humans to stop making excuses and start making changes. Thank you.
You're muted, Dr. Murthy.
Thank you so much, technical team. That was really great. And the name of the dinosaur is Frank, and he was going around in the UN headquarters during the recent General Assembly. And that's why I wanted to, show that. Thank you again. Over to you.
Thank you so much. Okay, I think we're ready to open the floor to questions from the audience. Please feel free to either raise your hand or just, we prefer if you ask the question directly, but if you'd rather just send it in the chat, then that's possible as well. Yes, Dr. Ali.
I thank you first, Padmini, and thank you, Siham, for really, and apologies also again for the mishap in the handling the video. It's a straight question. I mean, most of the things you've talked about are related to inequality that is built into this culture or the way women are treated. The climate change just aggravates the thing. Mm. So when you're talking about quote unquote solutions, now then you'd have to change the culture, right? Basically, I mean, it's not like women are more vulnerable to diseases because they are a weaker, for example, gender. They are more vulnerable because they are not getting adequate attention as they should, right?
Yeah. So do you want me to jump in with my response?
Please, please.
Thank you. Yeah, first of all, thank you for the opportunity. And yeah, listen, that's the thing. We improvised. We had a mishap, but we got it fixed. Unfortunately, fixing the climate crisis is not as easy as postponing it to the end of the presentation and getting the video to work. So by gender specific, I mean women should be at the center of policy making. because nobody knows what the effect is better than the person it affects. So we need to have more women included, and also the whole culture. And again, this is the thing. We need to make sure that women are valued the same as men, which is easier said than done in a lot of cultures still. And there's unfortunately not even a single place in the world where we have full gender parity. So we need to have women given seats in decision making, like in parliament or head of CEOs or private sectors, and simple things of even having gender specific protective gear, which I stress is a small start. So we are all in this together. And again, we need men to work with women to make this happen. Because Dr. Awad, in the spelling of woman is men. So it just shows how men and women need to work together. So that is why at the drawing table, it's not men making decisions, it's not women making decisions, but having women with their input and getting the input from men to see how this works. And also, even in making sure that we have more clean cooking stoves, because I talked about the internal pollution, which is an issue. So this is what we have to do, because more and more women are prone for that. And we need to have also in our healthcare system, not to digress, to have more stress on preventative care, because that's one of the things I find that in so many societies, women do not go to their medical providers unless they fall sick. So all these are linked, because if you address the problem before it becomes worse, then you're at least mitigating the aftermath of it. I hope I've answered your question.
What I was trying to say is that there is inequality in dealing with women's health, period. Now, the climate change just adds a little bit more of a stress on a system that is already faulty. So it shows the cracks more quickly. Now, if that's correct, then if I'm going to solve the problem, I could just I could ignore the climate change part, because it's just really an extra stress that adds to the system. But the system itself is faulty. The women are not treated right vis-a-vis healthcare, period. Is that correct or not?
Yes and no, because it is, if you're talking about climate change, as you said, climate change has added a greater stress, but women need to have, that's what I said, more access to everything. And we need to, when you have policies in place to address climate change, see how they affect women, because most of the climate refugees are women because of the lack of protection. So this is like a three-dimensional puzzle. You just can't focus only on one thing and say we push this off. So it is still, what shall I say, it's a trial and error, and we all have to be at the drawing board, come up with so many drafts, tear them up before we come to something which is practical, cost beneficial, and at least has a good outcome.
Thank you. Yeah. I also have some questions from the audience here. I'll start with a question from Mrs. Dina Nagati. She's asking, what's the relationship between climate change and women's health in respect to, I'm going to combine this with another question, maybe highlighting more this issue in the Egyptian context, and your thoughts about that, please.
Okay, thank you so much. You know, first of all, is in the MENA region, I mean, there are some effects in so many parts like women have, but very specifically to answer the question, and thank you so much for your question, is when, according to reports released in 2019 and 2020, unfortunately, in Egypt, this country ranked 55th of the 113 countries in the food security index. So there is a lot of food insecurity in the MENA region and in Egypt. And this is due to rising food prices due to climate change and food insecurity, and also the gender norms where women are disenfranchised, left out of the decision making, and also the wages. Women get less wages than men. So we need to have more of an overall haul in the private sector too, which recognizes that women play a pivotal role. And also to leverage women's key role, which I just talked about, as major workforce in agriculture, and they are the drivers of the economic growth. So this is a major issue. And unfortunately, the other challenge is that there is no safety net for women who are suffering food insecurity due to climate change. Again, we need to understand food insecurity is not always due to armed conflict, but it can also be due to climate change. And I think, as I said, the government of Egypt needs to be congratulated because for having the COP27 coming up soon in a few weeks. So hopefully that, one of the issues there will be the effect of what shall I say, the gender, how to make sure there is gender harmony, to use the term, in having policies which address climate change and well-being.
Thank you. Thank you so much. Another question is a more general one. Actually, a fresh graduate student is asking for your recommendations for some of the sources that you rely on when you try to get reliable data on women's health and climate change.
Okay, so one of them is to go to UN Women, WHO, UNICEF, and also the United Nations Development Program, UNDP, and they have a very good program. It's called Be Verified, where the UN, it does a fact check for you, because there's so much of misinformation there. But these are the reliable sources. And also, when you look at some of the NGOs too, working on a lot of issues, especially with the climate change, definitely. But these are the sources which really help. And remember, you always need to check your facts, and like the Be Verified, that really helps you.
And I will take the opportunity to actually ask a question that I've been thinking about since our previous discussion before this session. You mentioned something that you mentioned again on one of your slides today, which is approaching women's health from a human's right perspective. And I was wondering, as academics and researchers, and maybe even policymakers and the mixed audience we have, how do you think we can apply that in the work we do every day?
Thank you for your question. I think as academics and researchers, policymakers, basically concerned global citizens, we need to understand that when there is something, and this is what I tell my students or I tell my daughter, is read, think, ponder. Is it fair? Is it equitable? I come back to the same thing, not to repeat it, to say, what can we do? I'll just give you an example. I know this is, we have menstrual inequity, period poverty in so many parts of the world. The reason I bring this up, it's an important topic, but it's also related to climate change. Now, we're talking about climate change. We're saying don't pollute the earth, don't use plastic. But if you're not giving menstruators alternate options of using reusable menstrual hygiene products, how can you say, blame women to say, oh, you're polluting by throwing this out? And you say, oh, don't use a plastic container. But then are you giving somebody clean water to wash their utensils? So these are the questions we need to ask. And by human rights, I mean the lens which you asked me is it fair to all? And what you want for yourself, you want for the other person. Once we start putting ourselves in the shoes of the person, and a lot of people don't have shoes, or in the place of the person, We need to ask ourselves this question. And how do you do it? That's why you have seminars like this, and you should be congratulated for having this, a talk like this, and talk to people to say, what do we do? What can we do? And how can we work together by sharing best practices? And again, advocacy is a very powerful tool, but it's not yelling and screaming and waving a banner, but advocacy with practicality. So all these come, and inclusion. When people are disenfranchised, when you're looking at the 2030 agenda, leave no one behind. If you don't include people, you're excluding some and leaving some behind.
Yeah, I really appreciate those thoughts. And I'd like to actually bring back one of the other extremely important, I felt, point you made earlier about simply giving women a voice. And I think in the research we do, for example, I really am a fan and an advocate for community-based work that actually includes the research participants as part of the research team, because it's only them that can really explain or describe the experiences, the lived experiences. As you said earlier, it's the person who's affected who can speak to the effects of a certain event, whether it's food insecurity or some other impact of climate change. I really appreciate all of these points. We're almost at the end of the hour. I'm going to check one more time if we have any more comments or questions from the audience before we end the session.
While you're doing that, I would just like to say you made a very important point. That's why we need disaggregated data, gender-specific data, which you're talking about. And all this is evidence-based. We just can't say, yes, I mean, it was so cool. They had the dinosaur coming and talking, but the message is not the idea of a dinosaur coming, voiced by one of the well-known Hollywood stars. The message is, if we don't do something like the dinosaurs, the human race will get extinct. About climate change if we don't do something. So that's what it is. So all this is evidence-based.
Yeah, that's the thing. And actually in my previous experience conducting specific research on women's health, I know that now even including men in such studies have become really important, because it's about representation. And as you said, it's about inclusion. So even when we say gender specific and we say stratified or data that are specific to gender groups, it doesn't mean we want to exclude anyone, but it's more about paying attention to the needs of the different groups, and also understanding the effects that gender has on both groups and not only women. And I think that's really the way forward. I really appreciate all of your input.
Thank you very much.
I thought, as you said, it's such opportunities like this webinar that we get to learn and know about what's being done. And your international experience is absolutely outstanding. So thank you so much for joining us today.
Thank you. And thank you so much for having me. And it's partnerships like these, which are purposeful partnerships, as I like to use the term, which helped us move forward. So thank you so much, and all the organizers. And thank you, technical team, for fixing the glitch, and why I wanted that video to be shown, because it makes a point. Thank you so much, and have a good rest of the evening.
Thank you so much, and thank you to all of our attendees for attending the session. I hope you enjoyed it as much as I did. And thank you again, Dr. Padmini. Hopefully one day you join us in person in Cairo and we get to show you this beautiful country. Thank you.
Yeah, thank you so much. Bye-bye.
Thank you. Bye-bye.